Hello friends, welcome back to Learning Nails and Aesthetics. We are in the Milady Aesthetics book. Chapter 5, Skin Analysis. Starting on page 188, we will go to page 195, and that is the end of chapter 5, I believe. Hang on. Yes, and that does include the glossary. Keep in mind, I am not AI. Mistakes will be made. You can laugh with me. Let's get started. Perform a skin analysis. Knowing how to analyze skin is the first step in providing a successful skincare treatments and recommending effective skincare products, identifying conditions and contraindications, as well as providing thorough consultations and charting client notes, are all elements of good aesthetic practices. Educating clients on healthy habits and the cause of skin conditions is part of the service. Products, ingredients, different types of facials, and a home care regimen for preventative maintenance are all beneficial in caring for the skin. A series of treatments may be necessary to effectively help the client's conditions. 20 years of sun damage cannot be helped overnight. Realistically, it could take weeks or months to see a visible difference in the skin. Even if there is no obvious visible change, skincare treatments have positive benefits and make a difference. Information on choosing products for treatments and home care is presented in Chapter 6, Skincare Products, Chemistry, Ingredients, and Selection. Skin analysis may seem challenging, but practice and experience will build confidence in using this essential skill. Soon you will automatically notice skin conditions. Become adept at quick skin analysis in the waiting room, because sometimes clients need a quick product recommendation or are not sure what type of treatment they should schedule. This skill can be very beneficial in selling products or treatments. You can perform a more in-depth analysis when the client comes in for treatment. Knowing skin types, conditions, and the factors affecting the skin's health, as well as interview skills that encourage your client to open up about their skincare regimen, enables you to perform an accurate skin analysis. The best tool for analyzing the skin is a magnifying lamp with a light. A Woods lamp is a filtered black light that is used to illuminate skin disorders, fungi, bacterial disorders, and deeper levels of pigmentation, discussed in Chapter 10, Facial Devices and Technology. Or an electronic photo imaging system. I have one of those, they're awesome. Other handheld tools, such as a moisture analyzation meter and devices that magnify hundreds of times, are available to analyze the skin. Client information is personal and confidential, so be objective when you write on a client's chart. Clients will appreciate you remembering their children's names or their recent trip to Hawaii, so try to recall some personal information the next time they come in and keep it in a separate file or for your own personal reference. Your records could be legal documents in a dispute with a client. Write legibly, make sure you date all entries, and sign your name. Review the steps to performing a skin analysis in Procedure 5-1 and demonstrate your abilities to your instructor or set forth in the guidelines. Activity. Customize the skin analysis. Perform a skin analysis and practice consultation on fellow students. Complete a mock health history form with a variety of information that would be pertinent in the skincare consultation. Document your findings and record your recommendations. Check in. Describe the steps in a skin analysis procedure. What are the areas that the esthetician needs to review during the skin analysis? Procedure 5-1. Performing a skin analysis. Implements and materials. Gather the following supplies and products. Supplies. EPA registered disinfectant, hand sanitizer or antibacterial soap, covered trash container, bowl, spatula, hand towels, headband, clean linens, bolster, single-use items, gloves, aesthetic wipes, 4x4s for cleaning or disposable sponges, cotton rounds, cotton swabs, plastic bag, paper towels, tissues. Products: eye makeup remover or cleanser, facial cleanser, toner, moisturizer, topical sunscreen. Preparation: the 4 components of skin analysis are look, feel, ask, and listen. Record your findings. Procedure: review the client's health history questionnaire. Look for medical conditions, medications, allergies, or other indications that the client is not an appropriate candidate for treatment. While you are reviewing the documentation, ask your client questions for clarification if necessary. 2. Wash your hands as instructed in Milady Standard Foundations, which I read that book as well in my other videos. Check that out. Procedure 5-1, proper hand washing. 3. Look briefly at your client's skin, including the neck and chest, with your naked eye or a magnifying light. In order to achieve a more accurate analysis, you will need to remove your client's makeup in the following step. 4. Cleanse the skin. A client's normal state of dryness or oiliness may not be visible immediately after cleansing. Cover the eyes with eye pads. Make sure the eye pads are not too large, or they may block the eye area you need to analyze or treat. 6. Use a magnifying light to examine the skin more thoroughly. A Woods lamp or electronic imaging system may also be used. 7. Look closely to determine the client's skin type, the conditions present, and the overall appearance. 8. Touch the skin with the fingertips to feel its texture, its oil and water content, and its elasticity. Pay attention to the T-zone. Now she is doing this with gloves on, which I normally ask my clients if they prefer I wear gloves, or sometimes I will word it as, is it okay if I don't wear gloves? I guess it just really depends on how well I know them, because you can't really feel the oiliness on their skin with gloves on. Also, when checking for oiliness, don't touch their face with both hands. Use your pointer finger and your thumb and touch several spots on their face with just the one hand, and then you rub your thumb and pointer finger together on both of your hands independently. Is a more accurate feeling of the oiliness or dryness of their skin. I hope I explained that properly. It does help though. Okay. Overall, 8. Touch the skin with the fingertips to feel its texture, its oil and water content, and its elasticity. Pay attention to the T-zone. Read that one twice. 9. Ask and listen. Ask questions about the skin's appearance, the client's health, and their lifestyle to gain a better understanding. Verbally describe to your client what you are finding in your analysis. 10. Apply a toner, a moisturizer, or sunscreen to balance and protect the skin. 11. Recommend a skincare plan that includes professional treatments and skincare products for a home care regimen. Giving the client a treatment plan in writing and including some skincare samples is a way to build your clientele. Refer to Chapter 6, Skincare Products, Chemistry, Ingredients, and Selection. 12. Record your findings and your recommendations in the client's chart, usually after the treatment is completed. Competency progress. How are you doing with skincare analysis? Check the Chapter 5 learning objectives below that you feel you have mastered. Leave unchecked those objectives you will need to return to. Explain the process of skin analysis. Identify the 4 genetic skin types through visualization, palpation, and consultation. Differentiate the 6 Fitzpatrick skin types and accurately identify them. Distinguish the characteristics of sensitive skin. Recognize the intricacies involved with treating skin of color. Identify treatment options for the neck and décolleté. Illustrate examples of skin conditions. Explain the causes of skin conditions. Describe healthy habits for the skin. Determine treatment contraindications through evaluation, analysis, and consultation. Perform a skin analysis. And the glossary. Consent form. A customary written agreement between the esthetician, salon, spa, and the client for applying a treatment, whether routine or preoperative. Contraindications. Factors that prohibit a treatment due to a condition. Treatments could cause harmful or negative side effects to those who have specific medical or skin conditions. Décolleté, also referred to as décolletage. You have to say it like that too, it's a French word. Pertaining to a woman's lower neck and chest. Dehydration, lack of water. Extrinsic, primarily environmental factors that contribute to aging and the appearance of aging. Fitzpatrick Scale, a scale used to measure skin's reaction to the sun. There are 6 types. Type 1 is the fairest. Type 6 is the darkest. All skin falls somewhere on this scale when evaluated, on factors such as eye color, skin tone, heritage, and response to UV exposure. Genetic, related to heredity and ancestry of origin. Oh, here's one of those words. Hirsutism. What? That doesn't seem so hard. But it doesn't look like that. Okay. Condition pertaining to excessive growth or cover of hair. Holistically, a system of evaluating the entire individual in an interdisciplinary style, recognizing that body systems work synergistically together. Hyperkeratosis. Oh, sorry, that's wrong. Hypertrichosis. Condition of abnormal growth of hair characterized by the growth of terminal hair in areas of the body that normally grow only vellus hair. Intrinsic. Skin aging factors over which we have little control because they are part of our genetics and familial heredity. Isotretinoin, brand name Accutane, a controlled prescription medication derived from vitamin A that is used to treat severe acne that has not responded to other treatments. Melasma, a form of hyperpigmentation that is characterized by bilateral patches of brown pigmentation on the cheeks, jawline, forehead, and upper lip due to hormonal imbalances such as pregnancy, birth control pills, or hormone replacement therapy. NSAIDs, non-steroidal anti-inflammatory drugs, over-the-counter medication used to reduce inflammation, such as ibuprofen. Palpation, manual manipulation of tissue by touching to make an assessment of its condition. Photosensitivity, high sensitivity of the skin to UV light, usually following exposure or ingestion of certain medications or chemicals that result in accelerated response of the skin to UV radiation. Retides, wrinkles. Skin type, classification that describes a person's genetic skin type. Solar comedones, large open comedones, usually around the eyes due to sun exposure. Striae, Dermal scars due to rapid expansion or stretching of connective tissue, leaving deep red, pink, or purple linear marks on the skin that gradually fade to light pink or silver over time. They often occur during growth phases in puberty, pregnancy, and weight gain. Tech neck. Wrinkles that develop due to the repeated movement of looking down at a cell phone or other electronic device. Telangiectasia. Visible, broken, or distended capillaries less than 0.5 millimeters due to intrinsic or extrinsic causes. I have some of those. They're not real prominent, but not attractive, really. Tool, spelled T-E-W-L. Abbreviation of transepidermal water loss caused by evaporation on the skin surface. T-zone, center area of the face, corresponds to the T shape formed by the forehead, nose, and chin. Wood's lamp, filtered black light that is used to illuminate skin disorders, fungi, bacterial disorders, and pigmentation. And in the next video, we will do Chapter 6, Skincare Products, Chemistry, Ingredients, and Selection. I hope this video was helpful to you. Please comment, like, share, and subscribe. And we will be reading Chapter 6, pages 197 to 204. So I look forward to seeing you there. Thank you for watching. Bye.